we're going to label the parts of the lower leg, and we're going to use green for bones, yellow for muscle, and red for ligaments. And then we're going to use these little stars for the pulses. Okay, we're going to start with the Achilles tendon. Your Achilles tendon starts as the gastroc and then comes down and combines in with the soleus to become the Achilles tendon. You find it right here. Okay, then this is the belly of the gastroc. It's what you think of as your calf muscle. Then underneath, if we took the gastroc off, underneath of that is the soleus. Okay? Sorry. And then we have our posterior inferior tibiofibular ligament. So it's on the posterior side. We know it goes from the tibia to the fibula inferiorly, so lower than the one above it. So that is found right here. It's commonly sprained in a high ankle sprain. Okay? And then we're going to have the sesamoid bones. Okay, the sesamoids are found underneath of the metatarsal heads, right here. Okay? All right, so these are our metatarsal heads, and right underneath of the first one are our sesamoids. So this is our first, second, third, fourth, and fifth metatarsal head. Okay, so I'm going to put a sticker on the second metatarsal head. It's right here. Okay. Then we're going to have our calcaneus. You can find your calcaneus in a few locations, but we're going to put it right here on the bottom of our heel. Your calcaneus is your heel. And then your plantar aponeurosis is technically a ligament, and it's your plantar fascia. It runs from all of that metatarsal heads down into the calcaneus. So the whole thing of your arch is your plantar fascia or plantar aponeurosis. Okay? Then on the medial side, we're going to have the medial malleolus. Okay, so we can find her medial malleolus at the end of her tibia, right here. Okay, and then right underneath of that, we're going to have the deltoid ligament. Remember, it's a thick band of tissue right here. Okay, then we have our three guys. We find them on the medial side, but they are located in the posterior deep compartment. So first, we have our tibialis posterior. So just behind the medial malleolus, we'll have our tibialis posterior. Then we'll have our flexor digitorum longus right beside it. Okay. Then we're going to have our flexor hallucis longus right behind it. So those three are in the posterior deep compartment, run right behind the tibia, and then come down and wrap around and go to their location. Okay, we're going to find our posterior tibial artery right in that same area. Okay, so you just have to palpate around and find your posterior tibial pulse. Okay, so you can feel the pulse right here. You put your little star on the pulse. Okay, then we have our tibial nerve, which is in that same location. Okay, we talked about the head of the first metatarsal, or we talked about the head of the first metatarsal being right here. So then you can also see it right here on the medial side, the head of the first metatarsal. And then we have the base of the first metatarsal. As we palpate down that metatarsal, when you get to the end of that bone right here, that's the base of the first metatarsal. Okay. Then we have, right behind that, we have our first cuneiform. Okay, our first cuneiform sits right here. And then right behind it, the next bump you feel is the navicular. Okay, and then on the lateral side, we're going to have the fibula. The fibula starts here and goes all the way up. Okay, so anywhere along that path is the fibula. Okay, then we're going to have our lateral malleolus, which is the end of the fibula. Right here, the bump on the outside of your ankle. Okay, then our ligaments, the first one that's sprained in a normal ankle sprain is our anterior talofibular ligament. It's going to go from our talus, deep in there, up to our fibula, and it sits right here. Then we have our calcaneofibular ligament. It goes from our calcaneus up to our fibula, and it sits right here. It's the second one sprained in a normal inversion ankle sprain. Then here is our posterior talofibular ligament. It is the third one sprained in an inversion ankle sprain. Okay, then we have our peroneus longus tendon. Okay, our peroneus longus is the long one that starts up at the head of the fibula, comes down the side of the leg, is in the lateral compartment, wraps around here, and goes under the foot onto the inside, medial side of the foot. So you can find that tendon right through here. Okay, if I have her evert her foot, push her foot out, you can see it pop up right here. Okay, then our peroneus brevis attaches into the base of our fifth. It is shorter, it follows this path here, goes along with the peroneus longus, wraps around and attaches at the base of the fifth. Okay? Then we have the base of our fifth metatarsal. So in that same location, you'll have a green dot. Okay, that's the base of your fifth metatarsal. And then the fifth metatarsal phalangeal joint. So where the toes attach to the foot are your metatarsal phalangeal joints. So right here is that joint. And we're just going to put a red one there for that joint. I didn't have a color for the joint. Okay. Then we're also going to have our cuboid. So right after the base of our fifth, we're going to go back here, and this is our cuboid, directly behind the base of the fifth. Alright, now we're going to move to the anterior aspect. We'll have our dome of our talus. Remember, you can find that by plantar flexing the foot. Right here is the dome of the talus. Okay, and then we have our anterior tibiofibular ligament. Okay, so it's going to go from the tibia to the fibula inferiorly. So right about here. That is also the one injured in a high ankle sprain. Okay, we have our tibialis anterior tendon. So we're going to have them dorsiflex their foot, pull up their foot, and you can see a tendon pop out here. That's the tibialis anterior. That muscle continues on and goes up and is the big muscle in the front of your leg. Okay, your extensor hallucis longus tendon extends your big toe. So you have them pull up on their big toe. Anywhere you see that tendon there, it's just a little bit more lateral than the anterior tibialis up there, but it also comes all the way down into the toe. Okay, then we have our extensor digitorum longus, and that flexes our rest of our foretoes. You can see the tendons popping up here, but then no, it's just going to be a little bit more lateral to the extensor hallucis longus. Okay, and then we have our metatarsals. These are all of our metatarsals. Okay, we're going to put a dot on our first metatarsal. It's going to go right through here. Okay. Okay, then we have our second cuneiform. So remember, our first cuneiform we found over here. We know our second cuneiform is right here. Then our third cuneiform is next to that, right here. So those are our tarsal bones. Okay, and then to find our dorsal pedal pulse, we're going to go between the second and third metatarsal and feel for that pulse along that path. Okay, so you feel it right here, put your little star down, and set.